is Kate.
is O negative.
This will tighten around your arm, okay?
Positions in healthcare are pretty unique and they require a lot of training.
Let me check your vital signs for you, okay?
Okay.
But you don't always know the number of jobs that you need. In some cases, it might be one, it might be a dozen.
Stick this on your finger. Good.
I'm Mike Wokich, the Chief Human Resources Officer at Children's Hospital, Colorado, and one of the originators of the Greater Denver Healthcare Partnership. The thinking behind it was how do we get employers and the workforce system and the educational areas to work together to develop training programs for jobs that we're in desperate need of filling.
So would you weekly test the baby?
Partnership allows you to sort of share the risk with trying to do some of these things.
Oh, you can look it up over here.
I'm Greg Rossman. I'm the Chief Human Resource Officer at Denver Health, and I'm pleased to work with the Healthcare Partnership on workforce issues here in the community. So it's very helpful to work closely with other hospitals to create programs where we can recruit people and train them and interface with the educational facilities.
The workforce partnership in particular was vital because they understand both the education and training side and the needs of the employers. You naturally don't go to your competitor to say, hey, let's talk about ways we can partner together on a training program. Wouldn't have happened without them.
As a workforce center, being involved with the healthcare partnership is very critical because we do have limited resources and shrinking resources.
We've created one of the first industry-driven career pipelines for healthcare professionals.
It's been employer or healthcare driven.
A couple of areas of commonality that we found that we needed to focus and develop training included specialty training nursing, medical lab technicians, medical technologists, and surge techs. The lab was actually an area that helped prompt all this for me. Our lab director had said, you know, the lab population is aging.
And over half of our supervisory staff is going to be retired within 5 to 10 years. So I think the average age is now mid-40s to 50s for medical lab scientists. So who's going to be doing your lab testing in the future?
And knowing that you've got this potential gap coming up the road was a real problem. But lab people don't all leave at once. You might only need 1 or 2 or 3. So it makes natural sense if we have 1 or 2.
Check it out on the microscope.
My friend Greg Rossman at Denver Health needs a couple. It's much easier then to develop that curriculum and get others involved to make that happen.
One of the other more innovative things that we're doing is we're using subject matter experts.
Forget which is which.
Actually, they're all 100.
Okay.
Involving staff and managers on the front line to design these programs and interface with the students.
And we got to ask the hospital, voice our opinion, and tell the programs, listen, this would help us if you would prepare your students this way. So we were able to work directly with the program directors.
So this model works very well because we're correctly sizing the classes and the clinical placements.
It actually provides for students through these training programs a practicum of sorts where they go to the site to learn.
I get trained by a bunch of different techs, so I get to learn a lot of different techniques, which is really nice.
So by letting us come into their labs and training here, we get the real world experience, hands-on with actual patient samples, even the weird stuff that does happen in the real world that's not maybe a textbook case.
Okay.
You know, we kind of get to get a feel for them, they get to get a feel for us, and so they're potential new employees that we hire, and we have hired many of them.
Workforce investment boards have been very supportive.
They bring funding. As a private employer, we don't think about grants and ways to get dollars to help fund things. The public sector team, they understood that.
With the partnership, we have funded over 24 ESNs at the Metro State, and 22 of them have found high-paying jobs in the area, a lot of them with our partner hospitals.
We can continue these programs. They're not just a one-time and that's it, because the needs in healthcare are continuous.
We're really looking at it long-term. We want a sustainable model of working together.
That if we can get a workforce that's trained, that meets our needs, and everybody benefits, then in the end we provide best care to patients. So it was a win-win-win all the way around.